WHIS is a platform. We're all familiar with platforms. We use Google, we use Facebook, we use Twitter. These are digital platforms. So when I say a platform, you automatically think, oh, that's a digital platform. This is far better than a digital platform. This is meaningful interaction as a community on a social interaction level. So it benefits everyone. This platform is for 7 billion people. It has a great opportunity to bring people together, to tackle social isolation at the same time as we grow our economies for sustainability and regenerating communities, from children in the schools with kids to our senior citizens with seniors. We all work together collectively. That's the beauty of this program and this project. It's there for everyone. We've brought it from a tweet to now on the international stage. You know, we've spoken at Davos. We're supporting the Sustainable Development Goals, their implementation in 25 cities worldwide. It'll impact over 100 million people. This is just the start. Where we see ourselves in the future is growing and evolving and supporting communities worldwide in your local community, making a difference on that circular economy model, generating income streams, but then reinvesting it back into the community. But the ownership is with the local community, so it stays local. Good morning, everyone. Gareth Presh, and founder of the World Health Innovation Summit, and I am delighted to welcome you to this morning's discussion on cancer advocacy in Africa. I'm just going to bring in our guests today, and we're joined by our colleagues in Kenya and Africa, in Kisumu, Lamek and Ivasha, and we're going to discuss advocacy. And particularly the power of advocacy through social media. And hi, Lamek. I'm just wondering if you could do a very short introduction as we start this session on WHIS Talks.
Thank you so much, Gareth. To our viewers and our listeners, my name is Lamek Oyochola. I work at Kisumu City Cancer Organization. We are based in Kisumu City. A town or a city in west side of Kenya. Basically, we do cancer awareness and mitigation at the community level, and also we do a lot of patient navigation and patient support. Yeah.
Thanks, Lamek, and we'll get into more detail around your work and particularly its impact. Ivasha, could you do a short introduction to those listening and viewing this stream?
Hi everyone, I am Ivasha Shirila. I am a nutritionist at Kisumu City Cancer Organization, and apart from that, I'm a cancer advocate and also a thyroid cancer survivor. So obviously I got into the advocacy space because of having been impacted by cancer, and I thought that I might use my story to encourage people around me and also to get out the message of cancer awareness in any way that I can, and also using my nutrition background.
Fantastic. I think nutrition will play certainly an important role in cancer and in cancer awareness as well, just in terms of getting the message out about what we eat and how we can prevent cancers arising in the future. Lamek, perhaps you could give us a bit more detail around the work that you do at Kisumu and how you support patients with cancer, and some of the challenges that you face as well. It would be great to get an insight.
Okay, thank you so much, Gareth. At Kisumu City Cancer Organization, we have 3 major components that we normally we look at. We have cancer advocacy and awareness, and then we have a program called the Hope Beyond Cancer, and also we have another program that is called Inspire. So within these 3 components, when I started cancer advocacy, we are looking at prevention, early detection, treatment, and management. On prevention, we do create awareness on cancer education to the general public. On early detection, we organize screening camps in partnership with other organizations that are key players in cancer advocacy. Then treatment and management, we do a number of linkages and referrals, both at the hospital, and also we assist patients on how they can go through their treatment. So we work in closely and in partnership with the doctors. Then Hope Beyond Cancer is a program whereby we have a support group under that. And under this, we have patient navigation. We realize that patients normally face difficulties when it comes to access to treatment. So we do navigation. And also we do treatment support for those who are not able to get finances. We link them with the organization that can give support, our individual who can support their treatment. Again, we have support group whereby we provide a psychospiritual intervention and other complementary therapy in cancer management. That is following under Hope Beyond Cancer. And also we have nutrition and wellness. When I come to Inspire, Inspire is a new program that we are implementing this year. It's touching on agriculture. It's also touching on empowerment, and also it's touching on education. We realize that when the family is affected, all these areas are getting affected. When the mother is sick or the father is sick with cancer, the income goes down. So we were looking for what can we do to help these families stand again on their feet. And also on agriculture, we look at food sustainability at the household level. Education, we are looking at children who are affected both by cancer or they have lost their parents through cancer, and they cannot get access education. So we are helping. We try to chip in and give necessary support. And then on health, the other side, we see that our organization is specifically more on cancer, but we realize that there are some other illnesses that surrounds cancer that we can't leave behind, like something like malaria, HIV/AIDS. Yeah, there are some of the illnesses that we cannot leave behind because they need also our intervention. So Inspire has got that in it. So Inspire, it is an abbreviation, but in full it's called Innovative Solution for Poverty Intent Reduction. So that is what Inspire means. Yeah. So in a nutshell, that is what we do, Gareth. Thank you.
No, thanks, Lamek. I'd like to ask Ivasha just around the importance of nutrition and from an educational perspective, preventative measures that you have in place. Lamek's talked about some of the programs. How do you implement them in terms of your awareness programs? What's the challenges, and how are you managing to reach these groups?
With nutrition, we try to have outreaches. For example, if we do have an outreach whereby there's mass screening or we have a cancer event, we always include health talks, and under these health talks, nutrition comes in, where we talk to the masses about how they're supposed to take care of their food. When it comes to the patients, we have to tell them how they're supposed to take care of themselves, such that they are not overwhelmed by treatment. So we always encourage people to have to take care of their bodies. You do not need to take care of your body because you have cancer, but even before or just on your day-to-day living, you have to have good nutrition involved in your life, because that is a preventive measure. And also, just in case cancer hits,
it will not easily break you down because your body is strong and you're able to your body is strong and the medication will not be too much on your body. And also another thing that we've done, we've written a few articles that we put on our website concerning nutrition and cancer. And in this COVID season, we were able to have Zoom meetings whereby we bring in speakers. And also myself as a nutritionist, I've also done some talks over Zoom calls because that's the only way we've been doing it at the moment because we are not supposed to have physical meetings. So we've been able to do that. And then we also prepare meal plans which are shared with the support group members. So they are able to access, and in those meal plans, we try to make sure that our support group members are able to access the food that are available locally. So we try to simplify those meal plans such that when the support group members read them, they see something that is locally available. They don't have to get stressed about finding things that maybe they only see on the internet. So we try to make it as practical as possible and simplified because some of our members also come from the rural areas, and it is important for them to access meal plans that they understand. So apart from the health talks, we do also the meal plans. And during our meetings, we talk to the members. And there is also a chance for the support group members to reach out to us with questions they might have privately, or maybe they can request for a customized meal plan. So that is how our nutrition program works.
Excellent. It's a real holistic approach that you have, Lamech. Very much supporting the patient, listening to the needs, and then also involving the community so that you're, should we say, educating everyone in the wider community, which is just fantastic. We've got a couple of questions that have just come in, just from Michelle here. They're just asking Lamech, what are you doing to support mental health challenges associated with cancer, especially in rural areas? Perhaps you could give us an insight into, I know Ivashia's touched on the health talks within the rural communities, but perhaps some of the mental health issues. And I'd like to know as well, what about the stigma around cancer? How are you breaking that barrier down?
Thank you so much, Gareth, and thank you, Michelle, for asking that question. When you look at cancer management, mostly in Africa, mental health has been left out in cancer management, especially in public cancer treatment centers. So one thing we normally do when it comes to mental health, when one is newly diagnosed with cancer, it's really traumatizing, it's really hard. We engage them. We are attached to Jaramogi Referral Hospital, one major referral hospital here in Kisumu, whereby we go every morning, we engage with the patients, we talk. There is something we have which is called peer-to-peer. Peer-to-peer, it's a patient and a caregiver. We bring them together, tell them the journey, tell them their expectation, what they need to expect as they start the journey of cancer treatment. Again, we don't leave it there. We normally have follow-up at home. We go to the community where these patients are coming from, talk to the family members, bring them together, and then talk to them, tell them what they need to expect from the doctor side and what doctor expect from their side, and also what they need to expect from the patient side and what the patient need to expect from the family side, so that when they are walking this journey, they go into it knowing each one expectation. Because you realize that many patients sometimes they become hard because of stigma. But once you engage with them, telling them what they need to expect, especially when it comes to side effects of chemotherapy or side effect of the treatment on the side of the patient, we tell them so that when they will start seeing those side effects, at least they will accept. On the family, there is the aspect, the issue of finances, because it involves a lot. And this is where now the mental health challenge is coming in, whereby the stress of looking for finances to manage treatment. So on the side of the family, we are encouraging them to do small fundraising through other relatives, or we come in to help in registering them on national health insurance scheme, which cover most of the treatment and lower the burden of treatment. Yes, we work closely with spiritual reverends. In our group, we have Dr. James, who is a psychologist and also a reverend. He's really helping us also on mental health issues and spiritual intervention when it comes to cancer management. Yes, that is how we go about it.
And tell us a little bit about the fear. I'll put this to both of you. You know, in terms of diagnosis and in terms of late stage onset of cancer, do you find that many people in Africa have a fear in terms of coming forward, in terms of actually putting their hand up and saying, well, I've got a bit of a problem here, I have a growth, I have something? Is that a serious problem? You know, we know that cancers are rising across the continent. You know, what do you think can be done in terms of breaking that fear? Because early intervention, you have a better outcome, you know, you're more likely to survive. So how do we bridge that gap? And I'll put that to both of you. It's like maybe Lamech, you could answer that.
Yeah, thank you so much, Gareth. Right now, as we are speaking, 30 minutes ago, not even 30, around 20 minutes ago, one of the patient who is active on treatment just walked into the office, and she was sharing with me her journey. And one thing I came to realize is that everybody, when diagnosed with cancer, that fear hits them. But when they start their journey and meet same people that have same condition with them, then they gain confidence. So this lady who was just walking in our offices just right now was sharing with me that when she was starting her journey, she was really, she feared a lot. But when she started her journey, and something that her doctor told her, that don't wait to become a cancer advocate once you are through with your treatment. Start advocating for cancer right now. And you know, Gareth, when we were here, there is a small group that is meeting just next to us, a few meters away from where our office is, had to go and request for a chance so that this lady can go and talk to them. And when she went there and shared her message, it's like everyone was perplexed. Like, how can you say you have cancer and your body is just okay? So one thing I want to say is this. One way of overcoming fear is to come out to speak about it. Yesterday, I was attending to a patient that was diagnosed with myeloma, and it is stage 4. The whole of the session, the patient was crying because of fear, and it was the first time. Now, after engaging with her for around 20 minutes, sharing with her, she gained confidence. So one thing we do is that we want to make them understand that being diagnosed with cancer is not a death sentence. It's a new journey in life, so that you can overcome and become a warrior and share your story and encouraging one another. So that is how we normally approach fear and stigma in cancer journey.
Thanks, Lamech. We've got a couple of questions from Michelle as well. But Ivashe, from your perspective in this, you know, your outreach work and around nutrition, can that be a way of breaking fear down within communities so that there's an understanding around cancer? And of course, nutrition is an important part of anyone's life. So, not only for cancer patients, but for the wider community, and understanding that, if you eat well, you're less likely to develop, cancers. Do you find that it's a great way of kind of breaking the mold?
Yeah, I do find it a very effective way. If I were to go into the village and talk to the people about nutrition, of course, they have myths that surround cancer in their heads. So when I go there to talk to them, they'll start asking, but you are told you're not supposed to eat sugar because you'll have cancer. So I always preach the gospel of everything in moderation. As you eat your chicken, let it be in moderation. Whatever you do, let it be in moderation, because I do not believe in eliminating everything unless it really hurts your body. And even as you eat, you have to listen to your body. Does this hurt me? If the doctor says I should stop, why should I stop? So we encourage people that even as you eat that food, as you've been advised, also try to seek advice from other people. Try to listen to your body, because ultimately it is you who will determine what goes into your body. So I think even as we preach good nutrition practices, we also try to break the myths that are already formed in their heads, and let them know that these foods are safe if you don't overdo it. And also from the perspective of a cancer survivor, because I've been through it, there is that fear that after you've been diagnosed, you start eliminating foods because you're afraid that if you continue eating something, maybe your cancer will come back. So we ask people to keep trying to get advice. You just don't do things blindly. Maybe you came across something on the internet and it had so many shares, it had been forwarded to you. You ask a nutritionist near you if you can access one, or you ask a health expert about something that you saw. You just don't do, or you go on diet and yet you're on treatment. That is not something you're supposed to do, because you need to be in consultation with your medical team and also be in consultation with your body. So nutrition can be used effectively as long as there is communication on what you are doing exactly. Yeah.
I think that's great advice. Everyone should just seek medical advice, and also, ensure that it's evidence-based medical advice. And, you see a lot of stuff shared across social media. Unfortunately, it's not referenced. It doesn't have any, it's not linked to any medical publications at all. And it's misinformation that's shared widely, unfortunately. And it's a huge challenge for the health service. There's a question here from Michelle around funding. How are you funding these solutions, and what advice would you give to NGOs in Africa to do what you are doing? So Lamek, that one's firmly.
Thank you so much, Gareth. I just wanted to add something before I give answer to what Michelle is asking. One of the problem we are facing in Africa is myths and misconception surrounding cancer management, starting from culture, coming into food, and so on and so forth. So we realize that when one is diagnosed with cancer, first of all, they will have to consult the herbalist, the herbal doctors. Up to stage 3 or stage 4 is when they will look for conventional intervention, conventional medicine intervention. So those are some of the challenges we are facing here. A number of cases are stage 3, stage 4. So many cases, stage 3, stage 4. To curb this, we are using local radio stations. We do a lot of local radio stations talks. We talk to them, we tell them. And right now, people are coming out, though it's still very, very low. Coming back to Michelle. Michelle, your question is very good. Right now, when it comes to funding, it's quite challenging everywhere in the world. You might be having a good idea, and you might be implementing your programs very well, but sometimes funds become a challenge, so that you only limit you do only what you can do. What we are doing within our organization, we have a team of volunteers that they have come out to support what we are doing. We are reaching out to other local NGOs who might be having the same programs that we are doing. So we are combining effort. What I would like to tell NGOs in Africa, that working alone is not the solution. Working together is the solution. If someone is having $1, another one is having $1, bring it together, it becomes $2, and then you achieve your goals and objectives. Because the donor world right now is fatigued. When we get funds from friends outside, their funds specifically we take to the specific activity where we requested for the fund. If it is patient treatment support, we take it direct to the patient's treatment support, and we give back our report to the donor who donated that. And we give the receipt to show that the money they gave out really supported the patient. And that is what we do as Kisumu City Cancer Organization. And we have really helped quite a number of patients. During coronavirus, someone just saw what we are doing online in our internet, and then send us some little money, which we went and bought food for an old mama who is 75 years and have survived with the breast cancer for 40 years. And it was really a great impact in her life. Yeah, so that is what we are doing.
Yeah, I think it's amazing what you're doing. Just phenomenal work. I know financing is always a challenge. I think, hopefully in the future, Africa can, draw in investment, understand that by investing in, its communities, the health and well-being of its cancer patients, that there's an economic benefit, that there's a wider benefit for the community. So there's certainly opportunities in that space, and let's hope that we have more collaboration, particularly around R&D and research around cancer, so that we can bring in more treatments. I mean, even in the UK at the moment, they're struggling, substantially with the situation with COVID and the treatments that have been deferred, and that's happening all over the world. So there's a lot of learning going forward. It's going to have significant impact on the services and the service provided over the next few years. And then we have the challenges, of course, of staffing, which is a big challenge for everyone at the moment. So how do we encourage people to join the health service at the moment? So more community interventions, more community building, the nutritional programs that you mentioned, Avasha, they're going to play a significant role. My final question, I'm going to come to both of you. What do you think is the opportunity for Africa in the next 12 to 24 months, given the COVID situation, the learning? How are you going to bring Africa forward, in terms of a continent? What's your advice, Avasha, first and foremost, for the listeners?
I would say because of the COVID situation, of course, there's been social distancing, and people have not been able to go to the ground and talk to the community. So it's about time as Africans we embrace technology fully, such that we are able to be educated online, and we also bring in digital health ambassadors that are able to relay information to the masses through social media. So it's about time we embrace technology. We do not only have to use technology to do other things, but technology is a very useful tool for information, to keep yourself informed. So even as we ingest what we are getting online from that technology, we also need to do due diligence and make sure that we are not just getting information from everywhere. If this information we are getting accurate, you just don't sit and wait for that information to come to you, but what are the sources of the information? If Kisumu City Cancer is tweeting about breast cancer, what do you know about Kisumu City Cancer and what they are doing? And do you believe in the information that they are giving to you? If you see that it is a well established say institution, it is something that maybe you can say, okay, so the information they are giving me is true because they have done their research, they have nutritionists on board, they have oncologists on board. So even as we checking this information, you have to know where is the source, what is the source of this information that we are being given. But to embrace technology is where it's at. That's where we are heading. The future of Africa advocacy in cancer.
Absolutely, Lamek. I think what Ivash is talking about there is the wisdom, because the world is full of wisdom, and that knowledge that can be shared digitally. What Ivash was talking about there in terms of publication and where's the information coming from, where's it sourced. One of the most important things I always look at when I read something is where does it come from. So, for example, in the medical space, if it's from the Lancet or it's from the BMJ or from the World Health Organization, I actually know then that it's a reputable publication. We've actually, I think one of your colleagues is joining us actually. Hold on. Hi, Lilak. You're a consultant oncologist, I believe. And very welcome
Yes.
very welcome to WHIS Talks. We're actually just coming to the end of the session, but we have a bit of time, and we've had some great discussions with Lamek and Ivashia about the challenges and the fear around cancer, and then how Kisumu is supporting cancer patients in the wider context of the community. Perhaps you could just do a very short introduction, and maybe we can have a couple of questions for yourself around cancer treatment within Africa, and you could give some sound advice. We were talking about misinformation. The last point we were touching on with Ivashia was the digital technology and how we can spread information and wisdom. And we were looking at, publications from the likes of the Lancet or the BMJ being reputable publications so that we know they come from reputable sources. So I know that's quite a lot to take on board in this very short time. But first and foremost, welcome to WHIS Talks, and I would be delighted if you could just do a short introduction so that those viewing could understand your perspective.
Okay, thank you. My name is Laila Kwatanga, a clinical oncologist, meaning we do chemo and radiotherapy for our patients. Basically, we work in Kisumu, and we have been working with Lamek under the support group, and I think with Ivasha also. And Lamek told me today you specifically wanted to do the HIV-related malignancies. Lamek, am I correct or we are wrong on this one?
Yeah, you can talk about that.
Please do.
Now, our HIV malignancies, we have many, like we have cervical cancers. I think we are the ones leading in this part of the world, being East Africa, because of the HIV related. We have vulvar cancer, and then we have also Burkitt's lymphoma. We have a type of lymphoma that we have. And then, unfortunately, most of our patients, the only challenge we seem to have is resources. That is the main one in which they're starting treatment, and then the diagnostic part. To reach a point in which they can be able to get diagnosis is a bit of a challenge, but those are the areas in which I think we discussed with Lamek might be area of our support. The next area that we may need a bit of help in is the childhood malignancies, even related to HIV. We have some of our children who are HIV positive, and issues like immunohistochemistry become really challenging and an issue, and maybe some blood tests that are outside. So our problem is HIV. Most of them too, they are not economically stable, as in most of them don't have jobs. So remember, that is a person who is jobless, that person has HIV, that person has cancer also. So even when you send them for radiotherapy, as much as the body may not be able to take it, the psychological and the financial aspects they don't have, especially financial. So our challenges is just economically and maybe health-wise for the ones who don't have. Maybe if you can ask me a specific question.
Well, no, I think you've given us you're giving us an insight into the challenges that you face. Cancers are rising in Africa across the board, they're rising worldwide. You've had the impact of COVID-19. Also, I wanted to ask, are you facing challenges around recruitment and retention of staff from your perspective? I mean, you're probably handling how many patients? It's probably quite a lot. I'd like to get an understanding. I know we face global context here in terms of challenges of recruitment and retention, but from your perspective, is that a real challenge for you?
It's a real challenge for us in terms of employment. Like, our clinic is growing, but as we grow, you find that our staff may be retiring. The aspect of replacing them will be an issue, because as the clinic grows, so we don't have an issue of retaining, we just have an issue of replacement, and maybe adding more staff because the department is increasing. So now we have more patients but less staff. So we have to stock the staff as much as we can.
And your
But
work,
the issue of retention, we don't have any staff that is leaving necessarily in our area. Most of them are staying. Maybe retirement.
And do you find that the work with LAMIC and the patient group, I mean, that's a real opportunity there, isn't it, to kind of learn from, you know, co-design, co-create, working in tandem. I mean, these are real opportunities here in terms of engagement with the wider community as well. I know some of the activities that LAMIC does in the community around even the events running. It's a great way of advocacy, isn't it, for patients to kind of spread the message and then, should we say, tackle the fear that's out there in terms of diagnosing cancer.
Yes, with the help of LAMIC's group, the support group we have started to change our management. Like, we have put on one day, we are going to do psychosocial support. So the aspect of having LAMIC's group has also helped us, because we have met other specialties in the field of cancer. So we can increase our on-job training. There's the counseling part, the breaking down of the news so that someone can go through. The aspect of actually LAMIC's group has helped, and also spreading the word around, and also preparing patients for the treatment, the side effects. So his group has been very instrumental in adding for us knowledge and spreading the word. So we really appreciate anybody who can merge with them and us.
Yeah, do you look at the value created, like in terms of, you know, from a perspective of even procurement of drugs, shall we say, for cancer treatment? And, you know, do you involve the patient groups? Because there's a huge advantage there in terms of their knowledge. And, you know, support groups can also help with the analysis to drive down costs in terms of procurement. Is that something that's on the agenda? Because that, you know, that might be an advantage to you.
Currently, all our drugs, because we work in a government hospital, are procured through one system. So unless maybe in future, maybe the specific kind of drugs that we want, maybe like targeted therapy, which may not be available normally on government, maybe the support groups can help us on that aspect. But the basic chemotherapy drugs, which are for the common malignancies, that one the government buys. And our charges are a bit lower than most private hospitals, because it's a government facility. So the government doesn't make any profit of what it gets from the drugs.
Understood. I know that this area is expanding quite rapidly in Africa in terms of its growth around procurement of medicines abroad, and then you're going to need bioscience as well that will back up that. So it's an area of opportunity. LAMIC, just I'm conscious we're coming to the kind of end of the discussion. Last word to yourself. You know, it's been a great discussion, and perhaps you could just tell us what your future plans are.
Thank you so much, Gareth. It's an opportunity. I want to say it's an opportunity for Africa to embrace technology, especially in health management. Even consultation can be done through technology. A patient at home share with the doctor, and then they agree on the treatment plan. And from there, the treatment can take place to the nearby hospital, government hospital, whereby they don't need to travel all this long. Another thing is that awareness, just as Evasha had said, that technology has really helped us to reach out to a number of people. Even today, we were doing a lot of tweeting. We have reached a number of people with the message. Where we want to be, we don't have a palliative care center, and the doctor will agree with me. It is really, really a problem. We've been having a vision of putting up a palliative care center for the patients who are coming within this region. They really go a lot. They really go through a lot. And our advocacy also is involving the county government so that they can embrace the palliative care at the lower level. Those are some of the things we want to see as having in the next few years, 1 to 2 years to come. The doctor can talk about the comprehensive cancer center, which is also not within this region. We are really advocating for that. And I'm happy that the county government of Kisumu has put something in place. So in the future, we can see ourselves having a comprehensive cancer treatment center. Those are some of the big projects we want to see within our region. Yes.
Yeah, very important to have a vision. And I'll let the last word come to you, Leilak. Just around cancer and its overall outcomes, and you'll be well aware of this yourself, I'm sure, is in terms of having a comprehensive care centre so that you have all the expertise in one centre so that you can bring the patients there so that their outcomes are better from being in regional centres, shall we say. Lamek mentioned that the vision for the region is to have a comprehensive care centre for cancer in Kisumu?
Yes, we have started the project. The project is actually ongoing. Now, currently, I'm the only clinical oncologist, but by 2022, we are going to be 3. And we have a comprehensive plan on how we are going to finance.
We've just lost, I think, Leilak, just at that important moment.
Of the machines. Currently, we have done the ground wording is actually being built currently. It is on site, going on site as per yesterday.
Fantastic.
And then in terms of a comprehensive cancer center, yes, currently we don't have a radiotherapy center. So when we do the comprehensive, we are going to do chemotherapy and radiotherapy and also brachytherapy. And probably we are going to have a PET scan also. It is in part of our plans. In future, the department is also thinking of opening a nuclear medicine department. So that is our plans for Kisumu. They are ongoing. They are not on paper. They are actually on ground reality.
Well, fantastic. And also, just to let you know, you might be aware of this, but there is a lot of advances in terms of virtual reality and in terms of new radiology and diagnostic equipment coming online, where it's very cheap. There's some of the inventory that we're looking at from the US and in other jurisdictions. So if we have any information that I can share with you, I certainly will. Look, I just want to say thanks to Lamek, Leilak and Ivasha for joining us on WHIS Talks today. It's been a pleasure to discuss advocacy in cancer across Africa. And this program now is streamed live, of course, but it'll be available on our podcast. So my final words is to say thanks to everyone watching, and tune in on Sunday because we have our health literacy discussion that'll be chaired by Manuela Boyle. So thanks everyone, and we'll see you soon.
Thank you so much. Bye.